Hello, welcome to Physiology with Shakthi. So last time out we had seen about the autonomic system, some basic things about how autonomic system functions, what is sympathetic, what is parasympathetic, and about the preganglion, postganglion, and all those concepts. So if you haven't checked it out already, please take a look at the suggested link over there and check out that class before you head on over here. Right? So in today's episode, what we're going to do is we are going to basically compare the sympathetic and parasympathetic nervous system with regard to basic anatomy. Right? I've seen a lot of questions come from this in anatomy as well as physiology. So we need to understand few things about where the structures are placed, how it is placed, which is the ganglion, and which is the center, which is the preganglionic segment where it starts from. So a lot of small things like this have been asked. Also about the ratio of the fibers. Alright, so let's start. I'm going to draw the sympathetic system on this side, the parasympathetic nervous system on this side. Right, so consider this is the head and neck region and this is the rest of the body. Right, so over here you'll have your brain and your brainstem. Alright, and your vertebral column is going to start over here at level of C1. It will start, right, and it is going to go all the way to the sacral end. Alright, okay. So when we talk about the sympathetic system, we've seen how in the sympathetic system there are paravertebral, so next to the vertebra. So there are sympathetic ganglia which are present, which are paravertebral in nature. So from say T1 at a point corresponding to each segment T1, T2, T3, there are ganglia present like this. Right? Over here also there are 3 ganglia like that. Right? So basically these chains of ganglia which are present like this. Right? They're there on either side. Right? So they form your sympathetic ganglia. They form sort of like a chain over here. Right? So that is your sympathetic ganglia. So if you can see, they are very close to your vertebral column. And inside the vertebra, in the spinal cord, the intermediate lateral horn of the spinal cord, that is where the preganglionic fibers arise. So something that short, see, that is your preganglionic segment in sympathetic nervous system. Most of it, right? So first thing is you have to understand that there is C1 to C7 vertebra over here, right? So I'll draw it over here. Okay, so there is C1 to C7. Alright, so I told you how over here there are 3 ganglia which are present. There is one superior cervical ganglia, right? So this forms the superior cervical, and over here corresponding to C5, C6 somewhere here, there is a middle cervical ganglia, right? And over here we have a inferior cervical ganglia, right? Superior cervical, middle cervical, inferior cervical, right? And from here the next segment that starts is your T1. So from here on every segment has its corresponding ganglia. So this is your T1 ganglia, right? So what you need to understand is sometimes this T1 ganglia and the C7 ganglia, they end up fusing together and they form what we call the stellate ganglia, right? Yes. So fibers from C1 to C4, right? These preganglionic fibers from here are going to go to your superior cervical ganglia. Fibers from your C5, C6 is going to go to middle cervical ganglia. Fibers from C7 is going to go to inferior cervical ganglia, right? And sometimes inferior cervical ganglia and the T1 segment, they fuse together to form your stellate ganglia. Alright? Okay. So that is about the sympathetic system. But where does this give supply? The postganglionic segment, right? So the postganglionic segment goes to the corresponding skin region and the blood vessel of that region, which is your head and neck, and also it supplies the glands and many smooth muscles in your head and neck region. So through these ganglia which are present, right, the postganglionic fibers are going to supply your head and neck region. So sympathetic system postganglionic fibers supply to head and neck region is through these ganglia, right? So if you know it already, lesion in the superior cervical ganglia can result in something called the Horner syndrome, right? So Horner syndrome, this has been something we've been studying from first year onwards, right? In Horner syndrome, basically the sympathetic supply to head and neck is affected, right? So we told that dilation of the pupil should be there in sympathetic system. So that won't be present. There'll be meiosis, right? Partial ptosis, the levator palpebrae superioris, right? And there'll be absence of sweating on one side, right? Loss of senior-spinal reflex. So like that, basically in Horner syndrome, this superior cervical ganglia is affected, right? So through this, it is going to supply your iris. It's going to supply your upper lid muscles, right? It is going to supply your salivary gland. It is going to supply the skin all over. So basically, and the sweat gland. So basically, this is supplying a wide range of area in your head and neck region. Even this, right? Okay. So that is head and neck region of sympathetic system, right? Now let's come to parasympathetic nervous system, right? So in parasympathetic nervous system, it's kind of different. Over here, I told you in the C1, C2, all these corresponding segments, the intermediolateral horn of the spinal cord is where the preganglionic segments start. Postganglionic segments start in these ganglia, right? Preganglionic segment here, postganglionic here. But in case of parasympathetic nervous system, it's kind of different. There are a bunch of nuclei which are present in your brainstem, right? So these bunch of nuclei are where the preganglionic segment start. It's not in the spinal cord, but in the nuclei which are present. That is where the preganglionic segments start in the parasympathetic nervous system, right? So the first thing is your Edinger-Westphal nucleus, right? So we got the Edinger-Westphal nucleus, right? So this Edinger-Westphal nucleus is going to supply a ganglia which is close to your body, right? So this ganglia is close to your body like this, right? It is pretty much close to your eyes, right? So from the Edinger-Westphal nucleus, preganglionic segments are going to go all the way like this. You can see how long it is compared to how short it is over here, right? And the postganglionic segments from the ciliary ganglia are going to go to your eye, right? See how short this is compared to this, right? So basically that is going to make you, alright? So that is the Edinger-Westphal nucleus. Next up is your salivatory nucleus. We have a superior salivatory nucleus, we have an inferior salivatory nucleus, right? The superior salivatory nucleus, right? So superior salivatory nucleus is going to supply two different ganglia which are present close by, right? There's one ganglia here, there's another ganglia here. This is your pterygopalatine ganglia. This is your submandibular. Alright, so the superior salivatory nucleus is going to supply your pterygopalatine ganglia, it is going to supply your submandibular ganglia. Right? First let's talk about the pterygopalatine ganglia. Right? The pterygoid part, right? The pterygoid part is the palate, right? So these regions over here are supplied by this. So basically it is going to supply parts of the nose. So in the nose, what does it supply? The glands are present there, nasal secretions, right? Also, what else is here in this region? Your lacrimal sac, right? So superior salivatory, just imagine that the superior salivation, part of superior salivation is also making you cry, right? So that is why when we cry, we end up basically lacrimating as well as sometimes having nasal discharges as well, right? So that is your pterygopalatine ganglia, right? And from the submandibular ganglia, it is going to go to your salivation, right? Submandibular as well as the sublingual glands. right? So what part of salivation is still remaining? Parotid gland, right? That is supplied by your inferior salivatory nucleus. I told you two salivatory nucleus are the superior and inferior. Superior gives lacrimation as well as salivation through submandibular, sublingual, while the inferior salivatory nucleus, that is going to give supply to your aortic ganglia, right? And from the aortic ganglia, it is going to go and supply your parotid gland. From the aortic ganglia, it is going to now supply your parotid gland, right? So Westphal nucleus, superior salivatory nucleus, inferior salivatory nucleus. Now what you need to understand here is in the CNS, next to the Westphal nucleus, there is your third cranial nerve nucleus, right? And from there, the fibers are going to the eye. Right? These fibers are going to the eye, right? So that is the motor part, right? So along with these fibers, your autonomic fibers are going to go along with this, right? So that is your third cranial nerve, right? Ideally should be represented like that. For your ease, I am going to write it in normal numbers, right? Just like that, the superior salivatory nucleus fibers are going to go along with your facial nerve, seventh cranial nerve, both of these, right? And next is your ninth cranial nerve, that is inferior salivatory nucleus. Now which nerve fiber is missing now? Next is the vagus, right? So the next set of nucleus is your dorsal motor nucleus, vagal nucleus, right? And parts of nucleus ambiguous, right? So just know that some parts of nucleus ambiguous goes along with this, some parts goes along with this, right? Okay, I haven't seen any questions based on that, so you can just forget it if it's too much, right? The dorsal motor vagal nucleus is there, right? From there, the fibers are going to go. But here's the thing, from this part, things are different in that this fiber will give supply to head and neck. It goes all over the body. It roams around basically, right? It roams around vaga bound. That is why it is called the vagus. So it's a vaga bound, right? It's going to roam all around your body, right? So it is said that approximately 75% of the fibers in the parasympathetic nervous system belong in the vagus, right? You can just notice it looking at it. Alright? Okay, and this basically supplies till parts of abdomen. So till the half of large intestine. Right? Obviously the proximal half of large intestine. So in that comes your liver, right? The pancreas, parts of the GIT, the parts of stomach, blood flow to stomach, all that, right? So this basically covers your liver, gallbladder, pancreas, right? And all the way till your half of large intestine. Understood? So over here only these three ganglia supply head and neck. Over here all these that start in different nucleus, right, basically give head and neck, and this goes on to your rest of the body, even the cardiac plexus, right? Parts of the cardiac plexus here is supplied by your dorsal motor vagal nucleus, right? Understood? Right. So what is there beyond this? Beyond this, what actually is there is your reproductive organs, right? Urinary bladder, your defecation centers, right? So these sphincters and muscles over there. So that is what needs to be supplied, right? So that is where again it is going to come to your sacral segments. In the sacral segments, it is going to start from the intermediate lateral horn. So most often it is from S2, S3, S4, right? Can be prefixed, postfixed and all. And basically it is mostly from S2, S3, S4, right? Okay, so from these segments, just like here, from the intermediate lateral horn, the fibers are going to arise, right? And they are going to go to some ganglia which is close by. And even the vagus, you should know that there are, because it covers a large part, it is going to go to different ganglia which are close to the tissue or even embedded into tissue, right? So from here, these fibers are going to go to different ganglia here and supply, right? So these form set of pelvic nerve. Alright, so basically we just covered pretty much the entire part of the body through your parasympathetic nervous system. Right now we have your sympathetic system remaining. All we've done so far is just the head and neck region. So now we need to understand about the sympathetic system supply to the rest of the body. Right, so the next segment from T1 till T4. Right, each of these segments have a separate ganglia. 1, 2, 3, right? T1 to T4, and all these are going to form your cardiac plexus, right? So these cardiac plexus is going to supply your heart. The sympathetic supply to the innervation to the heart is through the cardiac plexus from T1 to T4. Fine. So what you need to understand is, apart from this visceral connection, each of these segments are going to go to their corresponding dermatome in the skin as well. When we talk about T1, right? When you talk about T1, it is going to go to your skin, where it is going to supply an area like this, corresponding to your T1 all the way till here like this, right? So this segment is supplied by your sympathetic nervous system. Right, so they form the pseudomotor bundle, which is going to give supply for the sweat glands and blood vessels of the skin and all. Right, so there was one question which was present. In case of muscarinic poisoning, there was increased sweating which was seen. So people got confused with that question. Right, so basically this supply to the skin sweat glands is sympathetic, but ultimately it is sympathetic cholinergic. They are pseudomotor nerves, it is sympathetic cholinergic. They release acetylcholine and they finally act on M3 receptors. Right? So when there is a muscarinic poisoning, regardless of whether it is sympathetic or parasympathetic nervous system, it is still going to activate the M3 receptor. Right? That is why there is increased sweating over there. Right? So like that, from T1 to all the segments, wherever dermatome segments are there, it will give supply to that segment. So remember that, right? Apart from that, I am talking about the visceral components now, right? One is the cardiac plexus, right? Now we need to go to the abdomen, right? We're still in T region actually. We only reached T4, right? Next is T5 to T9 segment, right? So from T5 to T9, so these are there in the vertebra of the thoracic region, but they are going to pierce the diaphragm and go to the abdomen, where they are going to go to certain ganglia which are there, called the pre-vertebral. So earlier we had talked about the paravertebral. Now in front of the vertebra there is pre-vertebral ganglia. There are collateral ganglia, right? So they are going to give supply to those ganglia. Also there is your adrenal gland. Right, that is another thing. Right, so from T5 to T9, these fibers are going to go to your abdomen and going to reach your celiac ganglia. So these fibers are going to reach the celiac ganglia. Right, so this is what is called the greater splanchnic nerve. Right, so over here this would be the greater splanchnic nerve, right? So this is the greater splanchnic nerve, right? Now beyond that we have T10 and T11, right? So that is also going to go in a similar way. It is going to go to your superior mesenteric ganglia, superior mesenteric ganglia, right? And this fiber that is going to pass, that is called lesser splanchnic. Right? Question from anatomy is going to come for this. Right? So this is lesser splanchnic, T10, T11. Right? T5 to T9 is greater splanchnic. So the next segment is your T12 segment. Right? Next is T12. Right? From the T12 segment, the supply goes to your aortico-renal ganglia. Alright? And these are what are called the least splanchnic. right? So greatest splanchnic, lesser splanchnic, least splanchnic. Okay, and beyond that we have your lumbar segments, right? So from the lumbar segments, especially the L1 and L2 will go to your, we already done superior mesenteric, remaining is inferior mesenteric, right? So just like this, first half and latter half of the intestine, the lower parts of the intestine are supplied by the inferior mesenteric, right? Superior mesenteric, the upper parts, right? So from L1 to L2, the inferior mesenteric. Okay, and beyond that, the entire lumbar part is there, right? And the sacral parts are there, right? So that is another thing that is different about them. So in the sympathetic system, the lower parts of the sacral ganglia, usually they form a bundle. They combine together, fuse together and form a chain sometimes, right? So ultimately what happens is, just like you need to supply the reproductive organs, the bladder, defecation and all that, right? And just like pelvic nerves over here, from lower parts of lumbar and sacral, these fibers are going to go, right? So these are going to form your hypogastric. Most often it is from your sacral segment. These are the hypogastric, right? And they give supply. So that pretty much covers your entire body now. And by the time it reaches sacral, it has given supply to your entire skin as well, all the dermatose segment as well. What you need to understand here is, sometimes this aortico-renal, that region, right, the fibers which come from here, the preganglionic fibers, may not form a synapse here. Instead, it keeps going on, right? So especially these fibers which come like this are going to not fuse and keep going till it reaches your adrenal medulla, from where the next neurotransmitters of epinephrine or norepinephrine are released. So ultimately this kind of acts like a ganglia, where the ganglionic segment is going to terminate. Okay, and another difference is that the ratio between the preganglionic and postganglionic fibers. What you have to understand in parasympathetic nervous system, right? These fibers are going very close to the ganglia, right? Very close to the target organ, right? There is not much chance for it to keep spreading after that. It is only going to supply that. For example, for lacrimation, it is this. For controlling the pupil, it is this, right? For salivation, it is this and this specific glands. But over here, one superior cervical is branching a lot, right? So the preganglionic to postganglionic ratio sometimes is like 1:1 here, right? A little more than that even, but mostly it is like 1:1, right? But over here, it can vary, right? Like 1:20 and beyond that, right? So the postganglionic fibers are going to branch and diverge. So that is another question that I've seen from this, right? And the next set of questions would be in the renal system about your hypogastric nerve, the pelvic nerve and your pudendal nerve, right? The pelvic nerve through this is parasympathetic. The hypogastric nerve through this, right, is sympathetic. While the pudendal is your somatic, voluntary control, right? So parasympathetic activity, sympathetic activity and voluntarily controlling, right? So you're outside in a social situation where you can't be, you're full, right? Obviously you have to voluntarily control the external sphincter, right? So that is your pudendal. Okay, so that is it for today. I covered 3-4 sets of questions in this topic, right? Next time we'll go to the receptors and G protein coupled receptors and autonomic nervous system. All right, thank you.